Welcome to the Dr. Dance Mom podcast, your guide to strong dancers with a bright future. I'm your host, Dr. Christensen, doctor of physical therapy, dance medicine specialist, and proud dance mom. Let's dive into today's episode. Hello, and welcome back to the Dr. Dance Mom podcast. I'm your host, Dr. Christensen. Today will be a solo episode. We're going to talk today a little bit about a topic that I think is super important. And I'm going to talk about why dancers need a physical therapist in their corner. If you think about professional sports, granted, it's their job. So if you're thinking about professional athletes, it is their job to perform. But professional athletes have a team of healthcare providers to support them throughout all phases of their season. That team may include people like orthopedic doctors, physical therapists, chiropractors, acupuncturists, massage therapists, personal trainers, sports psychologists, and nutritionists or dietitians. Some youth athletes are training way above the recommended number of hours for their age. No matter what sport they're involved in, kids should typically not be training more hours per week than their age. For example, a 6-year-old dancer should not be dancing more than 6 hours per week. A 7-year-old dancer should not be dancing more than 7 hours per week, and so forth. Ideally, their training would also include 1 to 2 days of rest per week to prevent burnout and overtraining, and participation in multiple sports throughout the year. The recommendation is to avoid single sport specialization before age 13 to 15 to reduce burnout and injury risk. Up until age 9, the focus in youth sports should be on fundamental motor skills and fun. I don't know about you, but most 9-year-old competitive dancers are way past that stage. From 10 to 13 years, it is recommended to increase introduction to structured training and skill development. And from 14 to 18, that training should increase in intensity, add strength training, and sport-specific skill focus. If we think about competitive dance, that timeline is significantly skewed, and the degree to which it is skewed varies greatly from studio to studio. Studios with elite or advanced minis and juniors push the timeline the most, and those whose curriculums progress more slowly are closer to this timeline, but often still pushing it ahead. In dance, there's an unspoken level of competitiveness that comes from within the studio that creates pressure for kids to feel like they need to do more and more each year. Studios don't usually stifle this at all because more enrollment, more participation increases their profitability per student. It's really up to the parent to educate themselves and help their child steer the train once they've hopped on. Kids don't know any better. They see what their friends are doing and they want to keep up. They don't understand, and sometimes I also think the parents don't understand, the implications of adding more each year until they're in the middle of it and end up overwhelmed, tired, and burned out. If they're having to choose regularly between rehearsals and birthday parties or family events at age 7 or 8, they're going to quickly learn to resent dance. The truth is, most of these kids won't go on to have a professional career in dance. Some of the kids who devote the most time to dance at a young age burn out by middle school. This is a classic example of how burnout happens. The American Academy of Pediatrics has published a paper on burnout and overtraining. Burnout is part of a spectrum and is the entry level, so to speak, of the spectrum. Single sport specialization with very little free time and lack of opportunity to pursue other things can lead to burnout in youth athletes. Studies have shown that athletes who specialize early are at increased risk for burnout. The main risk factors include training volume and overscheduling. Additional risk factors include pressure instilled by parents or guardians, coaches, or peers. Coaches who are controlling, foster perfectionism, and encourage extrinsic motivation for participation are associated with higher risk for burnout. Athletes who have a negative perception of their relationship with their coach and environments where peers focus on performance as opposed to effort, or if there's intra-team conflict, also contribute to burnout. Perfectionism and people who identify themselves as an athlete or dancer and feel like they have limited control over sports decisions are at higher risk for burnout as well. Signs and symptoms of burnout can include fatigue, depression, or decreased interest in the activity in question, sleep disturbances, loss of motivation, irritability, anxiety symptoms, lack of concentration, unexplained musculoskeletal complaints, weight changes, decreased academic or athletic performance, and decreased enjoyment in sports. Because these symptoms can be consistent with any number of things, it is important that a holistic approach is taken to incorporate a thorough history, examination, and/or other testing to determine whether burnout may be a factor. Another risk is overtraining. More training is not always better. Children cannot mentally or physically handle the same training load as a teen or adult. Overtraining is an actual syndrome which refers to a group of symptoms that result from chronic excessive exercise or training with insufficient recovery to facilitate physiologic adaptation. Overtraining represents a progressing degree of dysfunction associated with a prolonged imbalance of training stimulus and recovery that can only be remedied by prolonged periods of rest. Symptoms are very similar to those of burnout and can include unexplained decreases in performance, fatigue, sleep disturbances, mood changes, and increased risks of illness and injury. Overtraining can also overlap with RED-S, which is relative energy deficiency in sport. This is typically caused by chronic low energy availability attributed to insufficient caloric intake to meet an athlete's energy expenditure. This is a very simplified definition, and I do plan to do a future episode just breaking down this syndrome. Although definitive data is not available, it is estimated that the incidence of overtraining syndrome in young athletes by the time they reach adulthood may be as high as 35%. Diagnosis of overtraining syndrome is vague and requires the elimination of other potential causes for symptoms. Some of the examples given were anemia, infection, endocrine disorders, and underlying mental illness. There are no specific diagnostic tests available for overtraining syndrome. If overtraining is suspected, treatment includes rest, optimizing nutrition, increasing sleep, and stress reduction. If symptoms and athletic performance improve, it likely confirms the diagnosis, but this may take several months. Risk factors include imbalance between training and recovery, being a female athlete, being an individual sport athlete, being an elite level athlete, repeated high volume events like weekend tournaments. So if we think about dancers, conventions, or competitions, can result in higher levels of accumulated stress that can overwhelm recovery, especially when they have back-to-back competition weekends and no rest from practice or rehearsals, which is very common. Simultaneous participation on multiple teams may also be a factor. Playing a sport while also dancing can be a great way to cross-train, but it may also increase risk of overtraining syndrome. According to the American Academy of Pediatrics, young athletes should participate in no more than one sport per day and ensure at least 1 day of rest per week from all organized sport activities. Youth athletes should also have 2 to 3 months off from sports per year. Overtraining syndrome can be provoked by stress from many sources, including training load, lack of sleep, environmental stress, academic difficulties, social problems, financial stress, family problems, etc. Insufficient sleep is a significant factor that can prevent full recovery between training days or events and can also increase risk for injury. I always say if you have a young dancer and you want to get a sense of what the training is like at a studio, as long as it's not a newer studio, look at the ratio of minis and juniors to teens and seniors. If the studio has a robust group of littles but very few high schoolers, then one of two things is probably true. Either the culture is not ideal or their training is not balanced or ideal. They may win a lot, which is what draws people to their studio, but something else is out of balance that makes it not worth staying long term. And burnout and overtraining may be factors in that scenario. So let's say you have a dancer, a cheerleader, a gymnast, an athlete that does their sport year round. How can you balance year-round training if this is all your child wants to do? A young athlete is considered highly specialized if they have chosen one main sport, have quit all other sports, and are training and competing more than 8 months in the year in one main sport. More than 8 months has been shown to greatly increase risk for overuse injury and burnout. Another source cites 3 to 4 months of rest from sport each year. Depending on your studio, this may or may not be the case. I could see maybe 3 months of rest if you add up all of their breaks on the entire calendar, but 4 might be a tough reach for a competitive dancer. Rest is so important for physical and mental recovery, so this time is crucial for continued success. Participating in a sport or activity like dance that involves a lot of repetitive movement for more than 8 months per year has been shown in studies to significantly increase injury risk. One source also recommends the total training hours per week in a year-round sport never exceeds 16 hours per week at any point in the season. There are many examples in dance where this number is regularly exceeded. There should be structure to their training, and this is where the dance world, I think, falls way short. The concept of periodization, or having an off-season, a preseason, and an in-season, is something that is implemented in many traditional sports but not applied in dance. Periodization helps to intentionally manage training load and intensity during different parts of the season. This concept is regularly applied to traditional sports programs, but has not been considered for dance. Granted, dance is vastly different in that there are multiple performance seasons and more concentrated timeframes of performance depending on your studio's format and the types of events that you participate in. Periodization can be applied to dance if we look at the year-round training cycle of a competitive dancer. Typically, summer is going to be the off-season after nationals if your studio competes in a nationals. During that time, you may be attending some summer intensives, but training load is typically significantly decreased, although I would argue that we're not getting 3 to 4 months of rest from activity during that time frame. Preseason is typically going to be the beginning of the school year, so from the start of regular classes in September through just about when your studio starts to compete, which varies from studio to studio. So if you start competing in January, then your preseason ends just before then. If your studio starts to compete in March, then your preseason is going to end just before that begins. Your in-season is going to be your competition season, and I would extend this to maybe a month leading up to that, which is when typically rehearsals are going to start ramping up and the intensity of class and rehearsals also start to ramp up. Next, I want to talk a little bit about long-term athletic development. There are 10 pillars of successful long-term athletic development published by the National Strength and Conditioning Association, which state that long-term athletic development pathways should accommodate for the highly individualized and non-linear nature of the growth and development of youth. Long-term athletic development pathways should encourage early sampling approach for youth that promotes and enhances a broad range of motor skills, so variability in their training programs. The health and well-being of the child should always be the central tenet of long-term athletic development programs, so prioritizing, again, health and wellness of the child. You should participate in physical conditioning that helps to reduce the risk of injury to ensure their ongoing participation in long-term athletic development programs. So this would equate to our strength and conditioning classes at dance studios, which are essential to help reduce injury risk. Qualified professional and sound pedagogical approaches are fundamental to the success of long-term athletic development programs. So making sure that we are employing qualified teachers and professionals to teach these concepts to children. A study in sports health by Jayanthi et al., titled Developmental Training Model for the Sport Specialized Youth Athlete, a Dynamic Strategy for Individualizing Load Response During Maturation, states that approximately 30% of youth athletes are highly specialized, which is defined as intentional and focused participation in a single sport for a majority of the year that restricts opportunities for engagement in other sports or activities. This study recommends that sport specialization does not occur before age 12 because it increases risk for overuse injury and burnout. This is now considered a public health issue. Many parents believe that specialization improves athletic performance and the prospect for long-term athletic careers in their sport, and are willing to take on the risks, either thinking they are minimal or just wanting to increase their child's chances of success. Diverse multi-sport participation may result in enhanced skill acquisition and limit potential risks for injury. This allows for introduction of more diverse movement patterns, decrease in muscle imbalances, and ingrained motor patterns. If a child is highly specialized, they have specific needs to reduce injury risk and to improve long-term success. Specialization is not necessarily a problem in itself. There are plenty of children who do go on to specialize in, say, dance, cheer, gymnastics. Those are just a couple of examples of common sports or activities that children will specialize in early on in their careers. What's important for these athletes is that they have a well-rounded training program that includes strength, conditioning, and good sport-specific skills or technique. They should be encouraged to play different sports in the off-season, which may be fall or potentially winter for dancers. This provides a break from repetitive movement of their primary sport and may help to develop more adaptable movement patterns and help protect against burnout in their main sport. Athletes are more susceptible to growth plate and overuse injuries during their adolescent growth spurt, which usually occurs between about 9 to 12 years of age, with a very wide variability between individuals. This is an important consideration when looking at early sport specialization because repetitive movement typically will provoke overuse injuries and growth plate sensitivity. That's something that needs to be considered when looking at athlete training programs for highly specialized athletes. So, what does all of this have to do with having a physical therapist? Well, considering all of the above factors, injury is highly likely as a competitive dancer. Physical therapists are crucial for wellness, not just managing injuries. Youth athletes who specialize early can benefit from individual guidance on how to properly train through growth periods to reduce their risk of injury and continue to be successful. I would also argue that individualized training programs are most important for youth athletes because they all have different movement strategies and they will all have individual needs based on their individualized anatomy that may not be recognized by their coach or teachers. Neuromuscular training targeting coordination deficits that increase injury risk may be useful for reducing the incidence of both acute and overuse injuries in young athletes. One study suggested that athletes who specialized earlier can be at higher risk of injury in the lower extremities due to decreased coordination at the hip and the knee joints, which may contribute to unstable landings, inefficient force absorption, and greater contact forces. A challenge for coaches and teachers is that each individual athlete has different opportunities, maybe playing on different teams, taking different amounts of in-house and or outside class. And so it is difficult to apply a blanket strategy to addressing some of these gaps. Another challenge is that the stakeholders in youth sports tend to prioritize short-term performance achievements over long-term athlete development. Parents, coaches, and teachers may be looking for ways to get short-term results and maximize performance in the moment versus looking to see how they can improve individually based on their individual goals. Things like preseason screenings can help assess risk for overuse injuries, overtraining, and burnout based on history, increases in load, and the layout of the season schedule. Working with a PT through the season can help monitor musculoskeletal and other complaints and shift training if necessary in the moment to avoid having to sit out or take dramatic action later in the season. A physical therapist can also provide proactive body maintenance and focused individualized strength and conditioning based on the individual athlete needs and sports based on their niche. A personal trainer or performance training coach may also be able to do this, but a physical therapist has a deep medical background and a deeper understanding of all the systems that contribute to performance. They may also be able to have a better understanding of your child athlete's medical history and how that is contributing to their current training needs. A good relationship with a physical therapist that your child likes and trusts can help bridge a gap in education. Even if the parent has a healthy outlook on training progression, extrinsic factors such as studio or peer pressure can easily lead the child to want to push for more, and more. The physical therapist can help to reinforce moderation and the proper training progression. We know kids don't listen to their parents when discussing these things, so having someone else in your corner to help reinforce some of those conversations can be really helpful. A physical therapist can also help to educate athletes on their bodies, giving them a deeper understanding of movement and where it should come from, as well as how it should feel. They can and should also correct alignment and monitor load during big growth spurts, also advising on safe ways to work on improving flexibility, strength, and coordination after growth-related regressions. Due to our diverse background in differential diagnosis, a physical therapist can also pick up on symptoms of other potential underlying medical issues and refer to appropriate professionals when necessary. Your PT can and should teach your athlete to be comfortable advocating for themselves and to listen to their bodies. Children have very limited experience in their bodies and often don't know what sensations or experiences are warning signs that something is wrong. A physical therapist can teach your child how to discern safety from danger in their bodies. The above are just a few ways that a physical therapist can really enhance your child's experience as a specialized athlete. Look for a physical therapist that has experience working with athletes like your child within their sport, as not all physical therapists have the same training, background, or interest in working with athletes. A performance-based physical therapist or a sports medicine physical therapist is usually the best choice for an athlete. But again, not all of them have experience working with youth athletes. So it is wise to ask around if you're looking for a physical therapist to work with your athlete or dancer, that they have the experience that you're looking for. For our dancers, there are some resources online that you can look at to find a physical therapist in your area that can help work with your dancer if you have those needs. One resource is Doctors for Dancers. It's doctorsfordancers.com, and that is a database that medical professionals who work with dancers can be listed on. It is a subscription-based website for the provider, so not everyone in your area is going to be listed on that website. Another resource that you can look for is IADAMS, which is the International Association for Dance Medicine and Science. They have a provider directory which lists all the providers that are members, which is a great place to start as well if you're looking for a provider in your area, whether it be a physical therapist or a doctor who works with dancers. Another resource that you can use is social media. Just looking at social media, trying to find someone that maybe does in-person or virtual visits in your area. A lot of therapists will do virtual telehealth visits as long as you're within their state. So that's a great place to look for a therapist or provider in your area. Another way is just asking around in your local community to see if anyone has experience working with someone that is specialized in your child's niche area. I hope this information helps some of you understand better why it's really important to have a healthcare professional in your child's corner. Physical therapists have direct access in most states, meaning you do not need a doctor's prescription to see one. You can just make an appointment. Your insurance may have other restrictions, so you may want to check with your insurance, but we're a great easy access provider that can help you to assess your child if they're dealing with a mild injury so that you can get them back to doing what they love quickly. I hope you enjoyed today's episode and learned something. Please be sure to follow or subscribe so you don't miss a thing. Also, make sure you head over to Instagram and YouTube and follow us there. Send us your listener questions, topic suggestions, and feedback at drdancemompodcast@gmail.com. That's Dr. fully written out, Dance Mom Podcast, also fully written out, @gmail.com. Thanks so much for listening.